Okay, so just a little bit on breathing, just to continue along these lines. Just like the head, it's not so useful to think about your breathing all day, trying to control it. It just doesn't work. Good thing is the autonomic nervous system takes care of it for you. So just take a moment to pause and feel. Come to sitting, right? So you can feel the ground with your feet. Sense the weight of your legs. And sense the seat. Whether you're sitting on a stool like me or you're leaning back, but sense the seat with your sitting bones. Sense the space between your sitting bones. And go ahead and find your sitting bones with your hands, right? So you'll sit on top of them. They feel like a couple golf balls, right? So if the fingers are touching that space between the sitting bones as your pelvic floor, you can just kind of tilt a little bit left and right, tilt a little bit forward and backwards so you can feel some movement in the sitting bones, and then just take your hands away. Right, and now just feel how your temporary awareness of your sitting bones is a little greater. Right, so now put your hands on your pelvis and tilt your torso forward and backwards. Right, so you feel like you're moving from the hip. Right, so tilt forward. Right, not like this, but more with the back that's not bending, right? So the movement's primarily coming in the hip. And notice if you go slowly, that as you go forward, you feel some more weight going into your legs, right? So as you come back, the weight starts to decrease. And if you tilt backwards, your legs start to get lighter. They start to lift. Right, so this is because your hip flexors are contracting as you go backwards to keep you from falling backwards. Right, as you come forwards, your hip flexors are relaxing, and then you're feeling the weight of your legs. Right, so now feel the weight of your legs as if your feet are on two bathroom scales, and as you come back to sitting upright, just see if you can maintain that weight about the same, right? So don't let your legs get much lighter, right? So this is a way to kind of train yourself to inhibit some of that unnecessary tension that we carry so frequently in our hip flexors, right? Our psoas and our more superficial hip flexors. So just sit like that for a moment and notice your breathing. And notice that your breathing is a little bit lower now that your feet are more heavy and grounded, right? So if you tilt back a little bit again, you'll feel that your breathing starts to rise. So take one hand, place it on your lower abdomen, and the other hand on your chest, and just notice how the hands move as you breathe. Which hand moves more? Which hand moves first? You might feel that one hand doesn't move at all. Right, so we'll restrict it so that you feel the movement is in the chest now. So as you breathe in, you feel that the movement goes up. The movement goes up. Right, now we'll keep the chest hand still and we'll breathe into the belly. Right, so that would be considered diaphragmatic breathing, right? So breathing through the belly. Right, if we go back to just the top hand moving, you'll feel that it's not just the musculature of your chest, neck, and shoulders. It's the musculature of your back that's contracting with every single breath you take. Right? So every breath you take, there's a lot of effort that you're making in your back musculature. If you just so happen to be one of those 90% of people that I see who breathe like this all day, right? So it might lead to stress or trigger points between the shoulder blades, it might be the middle lower back. But the bottom line is, if you're breathing like this, you're using a lot more effort and energy than you need to. Right? So again, let this be quiet and feel that you could sink your weight down into the lower belly, down into your sitting bones. And now just imagine that you could breathe into your sitting bones. Right? So basically what happens is your pelvic floor moves apart a little bit. Right? So the sitting bones just do a little tiny movement like that as you inhale. Right? Your diaphragm wraps around, right? And when you exhale, the diaphragm goes up into a little bit of a dome. When you inhale, it goes down. If you're tight in your core and you're breathing very shallow, the diaphragm doesn't go down that much, right? So you don't use the full capacity of your lungs if you're spending a lot of time with these tight abdominals, right? So you want to train yourself to let go of some of that tension, and then just begin to notice that as you are able to release some of that tension in your belly, right, in your sides and in your kidney area as well, you can start to get some breath there, right? So you can breathe into this area too, right? Your ribs, right, they open up. Right, if you remember from the first images that we saw from the pandemic of the patients who were in the ICU in Italy, they discovered that it was easier if they positioned their patients prone on their stomach. It helped them with their breathing. Right, and I think this speaks to the fact that we actually have more lung capacity on the back surface than we do on the front surface. So again, it kind of goes back to that idea of just being conscious of what's behind you, right? So if you just simply lean forward like this, you create a constraint in the abdominals, which will make it possible for you to begin to experience some breathing expansion into the posterior ribs and into that lower back, that kidney area. Right, but the main thing here is that you're learning to differentiate from this pattern in which you may have a tendency to breathe up. Right? So we want to notice that if that's what we're doing, we could put our hands on our chest or hand on our belly, and then we could consciously inhibit the movement in our chest and then promote some more horizontal expansion and downward expansion as we breathe. Right, so in the Tai Chi classics, or one of those classical writings, they say that the common man breathes through the neck and the throat. The enlightened man breathes through the soles of his feet. Right? So if you focus on your feet, you obviously don't have lungs in your feet, but if you allow for it in your imagination, you can visualize breathing through your feet, right? So it's like you're breathing into the ground, and you can feel it. You can detect that there's some sense of movement. I don't think we have instrumentation that can measure that, but probably has something to do with connective tissue that's all linked up to the diaphragm, which is also a postural muscle as well. So keep it simple. Recognize that you may have a tendency to do this, and that you don't need to always be like that. You can keep it calmer. And just notice how it changes, So check in with your breathing a few times a day. Maybe first notice it for 2 or 3 breaths, and then give it a suggestion, 4 or 5 breaths, and then just move on, right? That way, over time, you'll start to repattern what you're doing with your breathing. I think that's enough on breathing. Thank you.